I am now most excited to introduce our first speaker, Dr. Amy West. She is a specialist in sports medicine and physical medicine and rehabilitation. Dr. West is a graduate of Harvard Medical School and completed her residency in physical medicine and rehabilitation at Harvard Spaulding Rehabilitation Hospital. She did her fellowship in sports medicine at Maine Medical Center. Dr. West's focuses include non-operative sports medicine, musculoskeletal ultrasound, peripheral joint injections, electromyography, and concussion management. Her clinical and research interests include the female athlete, adaptive sports, lifestyle medicine, transgender athletes, and nutrition. She is active in the CrossFit community, serving on the CrossFit Games medical team, and she participates in various CrossFit functions and outreach events. Dr. West has been featured on multiple podcasts and has authored peer-reviewed video and written publications. It is our pleasure to welcome Dr. Amy West, who will speak about optimizing fitness at all ages.
So, thank you so much for having me here today. As an introduction, my name is Amy West. So I'm a sports medicine provider at Northwell Health. My focus is on non-operative treatment of orthopedic injuries and aches and pains. As well as I am an athlete myself, so I practice what I preach. I get very excited about the opportunity to talk about fitness and exercise and sports. So this is a great opportunity. So this is already, it's me, we're going to talk about that. So what we're going to talk about today, I'm going to touch on a few different subjects. The first one being the importance of exercise, especially in females. The physical and mental benefits, as well as different elements of fitness and what defines fitness. I'll talk about a few common sports injuries that I see, particularly in female populations. And then also, very briefly, some non-operative treatments that are available. So exercise, why is it important? So one, physical health. So the most important thing, maintaining a healthy weight, and what that does, essentially, reduce the burden of metabolic disease. So when we talk about metabolic disease, we talk about diabetes, hypertension. These things are essentially cause the majority of hospitalizations and disease. Talking about maintaining a healthy weight, so things like diabetes, hypertension, as well as any other cardiovascular complications of not maintaining a healthy weight. Certainly arthritis is something that I see quite a bit, and something to think about. So every 10 pounds of weight on your body is about 40 pounds of pressure on your knees. So you can imagine that if you have arthritis, the more overweight you are, the more you will feel pain, the more you'll essentially be debilitated by this condition. So maintaining a healthy weight is certainly very important. Also, as well as things like cancer, maintaining an ideal weight is important in lowering cancer risk as well. All right. Another thing as well is maintaining strength. So there's a condition called age-related sarcopenia. So what that is, after the age of 30, we begin to lose muscle mass at about 3 to 5% per decade. And this will just happen naturally. So it's important to maintain an active lifestyle to not only combat this, but also to potentially increase muscle mass, as this can help prevent weakness, prevent the risk of falls, which is something, the main cause of hospitalization and loss of independence, especially in the elderly population, and as well as fractures. So the less muscle mass you have, you're more likely to suffer a fracture from a seemingly small fall. So you want to certainly preventing that. As well in the female populations, osteoporosis. Certainly after menopause, you begin to lose bone mass. So by exercising, you're able to prevent bone loss and as well as build bone. So it not only combats but prevents further bone loss. Another reason why it's important, so things like endurance and also functionality. So you want to be able to maintain your mobility, your independence, and the ability to do daily tasks. So when we talk about doing daily tasks, things as simple as being able to cross the street quickly so you don't get hit by a car, or being able to lift a grandchild up, being able to participate in life without any restrictions. So it's very important to maintain your physical well-being for that as well. And then the mental benefits, certainly. Things like mood, so people who exercise have lower rates of anxiety, depression. The rush of endorphins when you exercise elevate the mood, as well as something like cognitive decline. So people who are more active, there's increased blood flow, oxygen flow to the brain, which has been shown to prevent things like dementia, Alzheimer's, etc. So now we're going to talk about, well, what is fitness, right? So it's important to be fit, but what does that mean? And it can be hard to define, because here there's 3 examples, and there's someone with a bodybuilder, so is that person fit? Someone who's running a marathon, is that person fit? Maybe a yogi, someone's very flexible, is that person fit? And when we think about fitness, we think about it, it's not just one of these things, it's all of these things. So fitness, basically, there's 10 physical skills, and that includes things like endurance, flexibility, strength, and then we think about things like coordination, agility, balance, accuracy. These are all parts of fitness that certainly if you are training in one modality, it's easy to miss the others. And that can certainly expose deficits in your abilities when you're faced with certain tasks. So another way to think about fitness as well is it's on this continuum, right? So there's sickness on one side, and then there's wellness, which is in the middle, and then there's fitness, which is on the far opposite end. And the more fit you are, if something happens to you, like, for example, COVID, or a major trauma, instead of being knocked into the sickness aspect, the effects you feel may only knock you into something like being less fit or more in the wellness area, meaning that you're better able to absorb perturbance to your well-being, the more fit you are. You're less likely to have severe repercussions. And this is something that we saw quite a bit during COVID, right? So people who started off who were already sick, so people with chronic disease, very elderly people, for example, were much more affected by COVID than people who are younger, healthier, etc. But being fit doesn't necessarily have to be because of your age. You can be fit well into your older age as well. So that's where exercise comes in. And exercise is more than running. So a lot of people I see, they do a lot of running, they're on the treadmill all the time, and that's great. But there are more things to explore when talking about exercise. So there's resistance exercises, high intensity exercises. So you can get the same amount of cardiovascular training in a very short, intense period of time rather than running on a treadmill for an hour. It's just a matter of increasing the intensity to help essentially induce the same amount of metabolic change. Things like weightlifting, and I'm not talking like huge weights here, but very small weights can also help build bone and muscle. And then we're talking about things like functional movements, which I think are very important, especially in our population. So functional movements, essentially what they are things that we do every day without really thinking about. So everyone needs to perform them in some capacity to live their life. So these are things that existed long before gyms did. So things like squatting, for example. If you got up and down off the toilet today, you did a squat, whether you realized it or not. Or something like a deadlift, for example. If you put your pants on today, that is an example of doing a deadlift. So these are things that we do all the time. And because they're not explicitly taught, if you look at this child in this picture, if you see a baby, babies squat perfectly, actually. They actually do it very well. It's just something that sort of naturally comes to them. As we get older, we sort of lose that ability. We lose that mobility, the range of motion to do that well. So this is something that we have to sort of train and remind ourselves how to do. It involves complex neuromuscular patterns, so it's not just one joint. It's not just a bicep curl. It involves full body movement and coordination. And things like functional fitness, incorporating that into your training program can really help prepare the body for everyday life. So, we look at things like gardening, for example, lifting a box. We would train those as, for example, squats and deadlifts. you're on a plane, you need to put something overhead in the overhead compartment. Or if you fall and need to get up off the ground, being able to lift your own body weight off the ground is actually a really important skill, especially as we age. And those things can all be trained in a gym setting. So things that are not functional movements, we look at things that are sort of traditional gyms, like things on pulleys and these kind of awkward movement machines. These are muscle isolation or single joint movements usually, and they don't often require a lot of agility or coordination to use. So it's hard to build the agility, the coordination, the balance if you're not really testing those things while you're working out. And then also, sort of traditional gym goers may be more focused on their aesthetic or what their muscles look like, but ideally you want to be using your fitness to live better. So it's not just like working out, but it's like training, essentially training for life. So it's something to think about when you're looking into training programs or working with a trainer and diversifying your training program. I want to talk very briefly about some common injuries, things I see in the female population. And first, when we talk about that, just think some anatomical difference between men and women. So men tend to be taller. Body fat distribution is women have more body fat, but it's also distributed in certain places, like the hips and the waist, example. And then women have less lean muscle mass. But something that's really important is something called the Q angle. So essentially, it's the angle at which your hips and knees meet. So in men, that's more narrow, whereas in women, that's much wider. And for a multitude of reasons, our hips are wider, childbirth and things like that. But that can predispose us to having certain kinds of conditions, musculoskeletal conditions, that can cause pain, and something I see quite a bit. So what this can lead to is something that I often call dead butt syndrome. So your butt is dead, but the good news is we can revive it. And when I say that, I see a lot of women who come to see me who have kind of hip, back, butt pain. Sometimes it's knee pain, and it's kind of like a general, everything hurts, kind of aching. And usually what the cause of this is something called your gluteus medius, which is your butt muscle, essentially, kind of the top part of your butt. And what it does is it's a muscle that, if you imagine lying on your side, it lifts your leg out to the side and it brings it behind you. So it's kind of a difficult muscle to isolate if you're not thinking about it. But also what it does is it stabilizes your hips when you're running, when you're walking. It also stabilizes you when you stand on one foot. So a lot of people actually that I see have trouble standing on one leg. They're all over the place. And part of that is because that muscle can get ignored. Because what thing that muscle does, it facilitates side-to-side movement. And as people, we don't do that very often. We go this way a lot, we don't go this way. Especially even people who are very active. I see women who run marathons whose gluteus medius muscles are almost non-existent because they're not using them, they're not thinking about it. And these muscles tend to be weak in most women. So even women who are very strong tend to have weak glutes. So I find that this is something that definitely can lead to a lot of musculoskeletal conditions. And this is how I was planning to test it, basically side lying, any kind of single leg stance, and if you're more advanced, can use single leg squat. Once you're able to do that, you really kind of tone it up, but most people can't. So weakness and dysfunction of this muscle can lead to excess motion in the pelvis. If you think this muscle holds your pelvis and your low back in place, if it's weak, you start getting more motion through that area. Then that leads to inflammation, that can lead to pain. Sometimes this is called bursitis. So people said, oh, I have bursitis on the outside of my hip. And sometimes that's accurate, but more often it's actually that this muscle is weak rather than there's an actual bursitis. And when you think about running is actually a series of single leg squatting. So you can imagine that if every time you're running, you land on one foot and your pelvis dips, you do that thousands of times during a morning run, that this over time can lead to irritation, inflammation, pain in the butt, in the low back, and sometimes in the knees. Because what this muscle does also is it controls how your knees land in space. And I'll show you that in just a second. But there's been articles written about it called dead butt syndrome in the New York Times. I hand this out in my clinic sometimes when people have questions about it. But another thing that this muscle does, it holds the leg bones out. So when it's weak, your knees will tend to cave in as you're running, as you're walking, for example. And then that can lead to something like this, for example. This is an x-ray of a knee. And what you see here is the kneecap of this person is sort of out of place, or it's a little bit off to the side. This is sort of a more dramatic version of this, but I see this in sort of micro levels, especially in a lot of young women who are runners, because they have this moment when they strike the ground that their knee is caving in, because those hip muscles aren't holding it in place. So then over time, the kneecaps start to drift a little bit, and then they get a lot of pain in their knee that they can't really describe. It's vague, it's achy, it's clicking, it's catching, that kind of thing. So it's another common thing I see in women. And then treatments for this involve a lot of physical therapy, involve a lot of squat, side-to-side movement, and then treating the pain with some anti-inflammatories if needed. But it's something I see fairly common. Another common, one more injury that I see a lot is something called a bone stress injury. So essentially, anyone's ever had a stress fracture or a stress reaction in the bone? Essentially, it's swelling in the bone that happens in sort of a pre-fracture state. And the two causes that are most common are something called the female athlete triad, which we'll talk about, and the other is osteoporosis or age-related bone density loss. So with the female athlete triad, I see this more in younger women, especially a lot actually in teenage girls. And what this is essentially it originates with low energy availability, meaning not eating as much energy as you need for your activity level, so not matching that, which then will lead to menstrual dysfunction, because if your body doesn't have enough energy, then all the hormones in your body start getting out of whack, and then one of the first things that happens is that girls start to lose their period. Then, due to the other hormones in your body, your bone density will then become less, and then as a result, you'll start getting these fractures because your bones are softer. This is seen a lot, especially in lean sports, so things like cross country, gymnastics, etc. And in high school girls, it's actually fairly common. I've talked to teams where none of the girls on the team get their period, and everyone thinks that's normal. It's not. It's important to kind of keep track of, especially in young women. And this is just an example showing how if you don't have enough food intake in your body, all the hormones can essentially get all crazy and cause problems. So another thing as women, we build our bone mass, it kind of peaks in our 20s. So once that process is done, it's done. So it's really important for young women to make sure that they are eating enough, that they're building that bone mass, because any derangement in that as a teenager will affect them long term. So it's really important that you build that foundation, because otherwise you can have osteoporosis for the rest of your life and be having these little nagging injuries and stress fractures. And by the time we see a bone stress injury or stress fracture in a young girl, that means the hormones have been deranged for quite a long time. So it's actually sort of like the last thing that goes on. So it's really important to get to the root cause of that. So if anyone has a stress fracture, it's not just a simple matter of treating the fracture. There's an underlying cause of that really needs to be investigated. And I find that often male providers might not necessarily be sensitive to that. So it's something to really push for if that's something that happens to you. And then another way we see bone stress injuries and osteoporosis, so it can be age-related, race-related. Certainly white and Asian women have this more often. Family history, so if your mother had osteoporosis, something to be extra aware of. This occurs after menopause due to reduced estrogen in your body. Or if you're on prolonged steroids, have something like IBS, IBD, celiac disease, where you're not absorbing nutrients into your body, this can happen. And we see this a lot with women who have a seemingly minor fall or accident, and they show up with these what we call fragility fractures, broken bones. And in this slide, essentially what we see here is something called a compression fracture in the spine. So often, I see someone who slips, falls on their butt, and then they have a lot of pain in their back, and what happens is the bone in their spine, because it's so soft, it essentially scrunches down. And it's a fracture, it's a very painful thing, but completely preventable when the bone is solid. So, other risk factors, not sleeping well, don't have enough vitamin D, calcium. Sometimes there's some family pressures there to lose weight. And then another thing to remember is that you can be overweight and still undernourished. So it's really important to look at the quality of the food that you're eating, not just the quantity. Or someone may appear to be well fed, but still may have nutrient deficiencies. So the last thing I want to touch on very quickly is some treatments that we offer. So really when treating female athletes, or women in general, musculoskeletal care, it's a multidisciplinary approach, really. So it's more than just treating the pathology. Often there are other things involved with that, like nutrition, sports psychology, physical therapy, and then me, sports medicine. But it's really important to treat the whole athlete or person, because there's often, it's not just a musculoskeletal issue. Another thing that I offer in my clinic, and something that can be helpful to people, is I do a lot of ultrasound guided procedures. So essentially using an ultrasound, the kind that you check babies with, to perform procedures, which there's many different types of procedures, but essentially it's a way of providing more accurate care. So when you're getting an injection, if you're ever getting an injection, you want to make sure that the person is using some kind of guidance to place the needle. It's the safest way to do stuff. There's also now is kind of no excuse to not do it. And unlike things in the other modalities, such as using an X-ray machine, which has extra radiation and things like that, this is a safer way of doing it without radiation. So it's also, so for something like a shoulder injection, takes accuracy from 65% to almost 100%. So it's, if you're going to have an injection, you want it to be accurate. So, basically conclusions here. Exercise important for physical and mental health. Fitness is very multimodal, so it's not just one way of training your body. You want to explore different kinds of ways. Many back, hip, and knee problems originate from the glutes, and it's important to keep your butt strong, including cross-training, side-to-side movement. Treating female athletes involves a multidisciplinary approach, and you should seek that when seeking your care. And then ultrasound is impossible, because it's the best way to do that. So, so I just want to thank everybody. Thanks for having me. And that's me to If anyone has any questions, I can answer anything that you need.
Any thoughts on using a lot of heavy weights for not that many repetitions versus lightweight doing a lot of things?
Yeah, so the question is using high weights for low repetitions versus lower weights for higher repetitions, and I think essentially both of those things are important to do. You want to mix it up. I think you want to be able to tax your body, putting out maximum power effort, so that's with those heavy, low repetition things. But you also do want to challenge your endurance as well by doing light weights more quickly. So it's important to do both of those things. It depends on, I would encourage that if you're doing the lower weight repetitions, that sort of increasing the intensity. So you want to be you always want to be pushing the intensity such that you feel as if by the end that you're getting the workout. Rather, if you do the low weights, but you're doing a lot of reps and you're not really taxing the system, the effects are not as good. Yeah, so it's based on a few things. So the question is, if you're in pain, do you continue to work out? And I say there's two kinds of pain. So there's soreness, and I call that a good kind of pain. So, and certainly soreness that's your body's way of telling you you're using a muscle you haven't used in a while, which is a good thing. And that is something to push through cautiously. Then there's pain, and when we talk about pain, we're talking severe pain that stops you in your tracks. Pain that prevents you from doing a full range of motion, or pain that if involves any kind of numbness or weakness. That's a little different. So, but the general soreness, aches, and, minor pain is fine to push through. I always tell patients it's better to be moving than not moving. So they're like, even if it's going to be sore after, I would advocate to do it. But you don't want to be in severe pain where you're not able to move for days on end. So, in general, soreness okay. Sharp pain, not okay.
I want to thank Dr. Amy West, and on behalf of Shire Center, token of our appreciation.